There are a whole host of options for treating osteoporosis. Along with a healthy diet and regular exercise, they can help keep you from losing more bone mass. Dr. Carrie Peterson explains.
The first step in treating osteoporosis is continued testing and screening. You and your doctor will need to know if your bones are stable or if you're continuing to lose bone mass. You may need to have follow-up DEXA or other screenings over time. Your doctor will also be watching the medications you take to see if they're contributing to any bone loss. If you do have some bone loss, your doctor may prescribe certain medication therapies. We'll talk about the three main types, and you can pause to take notes. The first are bisphosphonates. These drugs slow the natural process that breaks down bone. These can be taken as a pill once a day or a series of pills once a month. Certain types of bisphosphonates can also be delivered through an IV once a year. They can be used in both postmenopausal women and men, but they're not recommended for premenopausal women or women who may become pregnant, since the effects of these drugs on a developing fetus aren't known. The second type of medical treatment is a hormone replacement therapy using selective estrogen receptor modulators, or SERMs. Because these work like the hormone estrogen, they are prescribed for postmenopausal women whose estrogen levels have dropped. These drugs are used to both prevent and treat osteoporosis. One example of a SERM is raloxifene. For some women, this treatment can even lower your risk of breast cancer. Raloxifene is taken in pill form daily. The third type of medical treatment involves other hormonal approaches. One medication is called teriparatide, which helps bone formation. It's typically used to treat postmenopausal women and men with severe osteoporosis who are at a high risk of fractures. To use this medication, you'll have to inject it under your skin daily. Another hormonal approach is testosterone replacement for men. It's used when osteoporosis is due to low testosterone levels. Finally, calcitonin, a hormone produced by the thyroid gland, can be used by both men and women. It's given to slow the progression of bone loss and increase bone density. Comes as a nasal spray, which you'll use every day, alternating nostrils to avoid nasal irritation or side effects like nosebleeds. And it can also be given by injection. These drug therapies work well at slowing the progression of osteoporosis, but they're not a quick fix. These drugs will just be one part of an overall treatment that your doctor prescribes. You'll also be asked to start an exercise program and to cut out bad habits like smoking. And make sure you're getting adequate calcium and vitamin D. The good news is osteoporosis can be prevented and also tracked over time. That means you and your doctor can catch it early and start treating it right away.
The best approach to managing osteoporosis is to watch it over time. And if you don't know your bone mass, get tested. Start an active prevention plan of regular exercise and healthy eating. Thanks for being a part of Healthy Nation.